Imagine needing to undergo brain surgery to remove a tumor you know will grow back again. This is the news that 15,000 families are told each year in the United States. Glioblastoma is an aggressive form of brain cancer, and it is known to be extremely resistant to treatment. Surgeons can remove the majority of the tumor from the brain, but it is impossible to remove all the cancerous cells due to glioblastoma's unique pathology. As a result, almost all glioblastoma patients experience significant tumor regrowth within months after surgery. As of 2023, the FDA has only approved 4 drugs and 1 device for the treatment of glioblastoma, but these methods were only able to lengthen a patient's life by a few months. General cancer treatments, such as chemotherapy and radiotherapy, are minimally effective against glioblastoma because these technologies cannot pass through the blood-brain barrier to reach the site of residual glioblastoma tumor cells. That is why we aimed to develop a device that can successfully kill the residual tumor cells in the brain. Ensuring the device's efficiency and durability, with a strong emphasis on enhancing the patient's quality of life, we are proud to display our solution. Our device is called NIRVANA, a near-infrared vital anti-tumor neurotherapy application. This device provides light for photodynamic therapy with a wireless LED light-coupled fiber optic cable and a photosensitizer called 5-aminolevulinic acid, or 5-ALA, to attack and kill residual glioblastoma cells. So how does it work? Glioblastoma patients will be administered 5-ALA orally, and the drug will target and bind to the residual glioblastoma tumor cells in the brain. Then, a near-infrared wavelength of light will be directed toward these residual cells that have interacted with the 5-ALA. The light will be administered to the brain through the photodynamic therapy LED light application device, NIRVANA. NIRVANA uses a fiber optic cable coupled with an LED light and coil design for wireless activation and charging. The fiber optic cable is threaded up to the tumor site of the brain from the patient's upper chest. The 5-ALA becomes activated from this wavelength and generates a photochemical response within the glioblastoma cells. This photochemical reaction generates a form of oxygen that begins to destroy the nearby cancer cells that the 5-ALA targeted, leaving healthy brain cells and tissue unharmed. Coming in 2 modular designs, surgeons can choose to customize each NIRVANA implanted to optimize light delivery. Whether it be the cranial or chest device design options, therapy is refined and maximized. Reach NIRVANA with NIRVANA, promotes innovation, and gives those 15,000 families the solution they've been waiting for.